Well, hello and welcome back to the Success Catalyst podcast. This is your host, Nina Robert, and today I'm speaking with Jennifer Cain Birkmose, a trailblazer in healthcare and eldercare with over 25 years of experience as a global health and pharmaceutical executive. Jennifer has dedicated her career to championing patient access to healthcare. She's the co-founder and chief executive of VivaValet, a digital elder care platform based in Chicago. VivaValet offers trusted services to support older adults in living independently at home, eases the caregiving burden for their adult children, and fosters local business development. Jennifer is also a two-time TEDx speaker and brings a unique flair to her professional life as a Second City trained improv comedian. Originally from Oregon, USA, Jennifer has spent 24 years living outside the US, enriching her global perspective on healthcare and eldercare. I'm so excited to dive into Jennifer's journey in healthcare, her innovative work with VivaValet, and how she blends her passion for comedy with her professional endeavors. Welcome to the show, Jennifer.
What an introduction. Thank you so much, Nina. Thank you for inviting me to be on your show. It's amazing to be here today.
It's amazing to have you. So, you have over 25 years of experience in global health care and pharmaceutical industry. What initially drew you to this field, and what motivates you to continue championing patient access to healthcare?
Oh, what a great question. So I would say, what drew me into healthcare and to patient access, it's really about the love and the desire and the hunger for impact in terms of how can I help people live better lives? How can I help health systems be more effective? How can I create access for patients to the healthcare that they need? That's been like a red thread throughout my whole career. And I'm really lucky that I actually grew up in healthcare, that every one of my family's involved in that in one way or another, one profession or vocation that's all around healthcare, whether it be advocacy or medicine or even dentistry. So I think I really was raised in that environment, and I carried that forward into my career and used the different experiences I had along the way as kind of tools to create impact along that meta purpose component.
Well, that's amazing. I love it. And now, as the co-founder and as chief executive of Viva Valet, can you share the inspiration behind starting this digital elder care platform and how it addresses the needs of older adults and their families?
I would love to talk about that. So, I think coming from the tradition of being an advocate for healthcare and really driving access and advocacy, my friend and founder reached out to me and said, I've got this idea, and I've got this more than idea, I have this problem. And this problem is that she and I live outside of the United States, and we have
Mhm.
aging relatives. We're both Americans. We have aging relatives who are living in the US who require support. So if you look at this as the form of the same problem that we were both kind of having as a pain point and trying to solve,
Mhm.
is when you have loved ones that you wish to care for and that you wish to support and need support, how do you organize that care remotely? And so we looked at our own challenge, which is organized care that is reliable, quality, and most importantly, trustworthy. How do
Mhm.
we solve that problem for us? How do we explore that challenge and solve the problem for us? And as we continue to do that, we actually realize that we're not so different from any other person who's actually living in the same community, but maybe an hour's drive away or 30 minutes away, or has low daily obligations like raising children and having a demanding career. You still need to fulfill those things, and you still wish and require to support your aging relatives. So that was really the spark, which is we have these needs, we have this common challenge. We dug deeply into understanding the challenge that elders themselves have and the hopes, dreams, and fears that they have about living at home, and what are their aspirations for their, years that they have, that where they'd like to be living at home. So we really saw it from that perspective of what's the challenge they have, what's the challenge that we have to support them, how do we put those two together? And we also realized that for the first time, technology is enabling us to do this in a way that
Mhm.
we can do this. Because I think in the past, you weren't able to facilitate all of this in terms of a platform
Mhm.
environment,
Yeah.
from a tech perspective. And so we were able to do that. So that's the spark, that's the genesis of why VivaValet, why being a co-founder, why did we even start this? What were the challenges we were trying to overcome for us as the adult children, but also for our aging parents? Um, and also, how might we continue to drive this forward? Because many people will say, oh, tech for olders, tech for
Mm.
senior citizens, that sounds impossible. And actually, how we overcame that was we did a tremendous amount of research with olders themselves, and they helped us design our tech platform. So everything that you see there, we have like a faster mode and an easy mode, which is designed specifically for olders to be able to
Mhm.
facilitate their ordering, their interactions, screening what they need, organizing their services independently. Or if you want to actually have your younger do that, it's all very simple to do. And I think in terms of safety and trust, what's inspiring is that we're so rigorous in how we vet our suppliers and how we train them. They have to have like literally an exam, and then we
Mhm.
have to do test services before we actually allow them to work with our customers. And when they're out on our jobs, we always know where they are. We can monitor them. So I can always stand behind that kind of commitment to trust and safety for the olders and for the adult children who might be ordering the services.
Wow, I love that.
Thank you. I
And
should also probably say what the services are. So I'm sorry that I didn't, because they're non-medical services, but it's things like rides. So, again, like very often an older doesn't have the ability to drive anymore. Their license has been taken away. So it's rides, it's prepared food delivery. And what's great is that we deliver the food and we take away the waste. So they don't
Mhm.
have to manage the waste. So we take away all the extra packaging and things like that. We also do handyman services, which is part of home modification and home safety checks, and in-home cleaning, as well as in-home tech. If they want to have like their network set up, we can do that for
Mhm.
them.
Well, that's amazing. And these are all services that would seem like a real burden to an elderly person. And you know what I love about your perspective is, and I think this is the true essence of entrepreneurship, is looking for a challenge and taking it and transforming it into an opportunity. Because if you have a challenge, you're not alone. There's usually a gazillion other people like having the same challenge and facing the same problem, but that can transform into an opportunity, that can transform into a business. So I really appreciate and I'm really intrigued by this mindset that you have and this ability to transform. I love the word that you spark. This is one of my favorite words. Yeah, this spark is all we need. Like, there's a challenge. Okay, let's look from the other side. The other side is this is an opportunity for a business, and this is an opportunity to help other people. And I was actually going to ask you about the services, and these are all amazing services and help that every single elderly person, especially living alone or remotely from their children, would absolutely need on a daily basis. But I know that your platform also aims to develop local businesses, which is amazing. So can you elaborate on how VivaValet supports local economies and what types of businesses benefit from your services?
Yeah, so it's again, great question. So we really think of this as the win, 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 win,
Mhm.
because we're supporting the olders, we're supporting adult children, and let's call it what it is. It's the adult daughters usually who are the ones who are burdened with
Yes.
this. We're helping them. And then when it comes to local businesses, we actually we don't hire people into the company to deliver these services themselves. We work with local businesses that are already established in the community.
Mhm.
So part of that is we're looking for companies that are truly local, what we call mom and pop shops, and that they are
Mhm.
hyper local. They've probably been established in the community for a great amount of time. And we want to, and some of these companies are being pushed out from large corporate chains, right? So
Mhm.
we're trying to protect those services, and we contract with them, who are already local. And the benefit there is that they have an established reputation. They have great know-how. They know the community. They have a reputation in the community. They're trusted. And then we give additional training on how they can support olders. And for example, what is service with understanding? We do all this kind of compassion training and
Mm.
also some safety things that they need to be aware of when they're supporting these populations. So what we love is that they're actually being supported. So we drive business to them. So we do the marketing. They very often these small businesses don't have large marketing budgets. So we're doing the digital and the face-to-face and physical marketing for them that they haven't done to on a level and a scale that they've never seen before. Excuse me. So we actually drive customers to them. We also enhance their service offering. We enhance their capabilities and their capacity really locally. And we drive a new customer segment to them. So it's really exciting because everyone is winning. Again, the elders, the adult children, the community, the local businesses, everyone has a win from this business. Excuse me.
Wow, that's an amazing formula. I love it. Win-win-win business. That's like the best formula that can really help local businesses as you are right now. Establish trust between your clients, all people in need of such services, and the local business with your compassion training. This is the first time I hear about such training. I think this is very important for such very specific niche that needs compassion and needs understanding and needs to like people in helping this kind of in this kind of services need to be aware that there is a certain rhythm, there's a certain level of understanding, there's a certain maybe, I don't know, time that the person needs to express their needs or to give feedback, which is also very important. So let me ask you another question. Now, having lived outside the US for 24 years now, how has your global experience influenced your perspective on healthcare and the approaches that you take with VivaValet?
Yeah. So in every way, in every way possible. And a lot of perspectives, I've thought this chair that I'm sitting in this role, it's as if it's been, my whole life has been leading up to this moment
Mm,
because everything about how I have acquired professional experience, worked in advocacy or healthcare system design has really led me to this moment. And I've had this career in pharma, also in the World Health Organization, the World Bank. And so in so many ways, these are moments where I have understood how different healthcare systems work, how do
mhm,
different social insurance or insurance systems work, what are different models for elder care, what are different models for how people revere and care for their elders. I think in the United States, often these people become invisible. And so
mm,
one of our great passions and purposes here is let's honor that life that they've had because it is a gift to age. It is a gift to be 80 years old. We're going to have the most octogenarians we've ever had globally, but also in the United States, ever in our human history. It's a gift to have that. And with that gift, let's show some respect and some reverence for that life that's lived. And so I think, often people ask me about the blue zones. So those are, there is one blue zone in the United States, but there are others that are outside of the US. So it's given me a chance living outside the US to put my focus in other places to
mhm,
see how do those cultures revere and care for their elderly? How do they support healthy aging in terms of the physical aspects, the psychosocial aspects, the familial aspects, and emotional aspects? And there's a lot of these things that we're actually putting into our business as a result to support people. So that's exciting, I think, to find those things. And I think also having worked with different healthcare systems, the public insurance bodies,
mhm,
I've seen that some of these interventions will lower the total cost of managing a patient. So I think the benefit for the older is that they're getting better service, they're getting, support to live at home independently because that is their wish. 90% of these people want to stay in their home. They don't want to move away.
mm.
It's
Yeah.
expensive. It's minimum 90,000 US dollars a year to go into some form of assisted living.
Wow, that's a lot.
It's so much, 60,000 a year to have in-home care. So the longer we can keep them independent, the better.
Mhm,
And knowing that those people are supported by public insurance bodies to have these type of interventions where they're socially active, they're, having connections with the community, having this ability to really be the pilot of their own life and have purpose, those are things that actually make these patients less expensive to public insurance. So we took this model of an insurance company in South Africa that lowered their costs by 40%. There is a kind of companion company that we are it's also working in the US that recently did a study. They said they lowered their total Medicare, which is the public body that pays for older people in the US for their healthcare. They lowered their expenses by 9% total by
Okay.
having at least one service by them. So, and we offer very similar services. So we say that as a proxy is that these are all things that make a healthcare system and a public budget more sustainable because these people become less expensive. And the people, i.e. the olders, are actually having a better life, which is most important. And then, of course, the people like us who are caring for them have so much of this burden taken off of our backs.
I think that's very, as you said, sustainable way to provide service, because I think an old person does not really require a full-time employee on their side, like paying them 60,000 or 90,000 a year. That's a lot of money, but in your case, you're providing on-demand service. So when you need it, it's there for you. When you don't need it, you're at peace, stay at home, be independent, do as you wish, enjoy your years, and we're there for you. I love this formula.
Thank you.
I know you've spoken at a TEDx twice. So can you share what those experiences were like and how you prepared for them? What key messages did you aim to convey in your talks?
TEDx, in a word, life-changing.
I love
Truly
it.
life-changing. Um, I had two different talks in the year 2020, so it was the COVID period.
Okay.
And these were talks about the work. So you'd mentioned that in the intro that I've done some work in comedy, and I
Mhm.
do work in comedy. And before this time, I had created little ensembles in the community where I live, and we had done some work in a company to use the tools of improv
Mhm.
to drive collaboration, cohesion, creativity, and as a result, we created a new business model, which still exists today in one of these companies in the city that I'm living in. And that business model enables an innovative drug that's launched in the US to be launched in the major emerging markets within 12 months, which is a
Okay.
huge, major public health impact. So it's huge in terms of patient access. It kind of broke the mold. And sure, it wasn't that it was a comedy project, but
Mm.
those of us who were doing the comedy work together, we realized when we were doing these improv tools and improv games and
Mhm.
kind of just having a good time over lunch, what we called lunch and learn, we realized that we walked away from those moments with a kind of fairy dust of looking at the world differently. Our brains were really on fire, super connected. We were connected to each other. And it was amazing to go from that
Mhm.
into business meetings, because then we were just clicking, 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 and we could really create something. It's like we cleared the fog and we cleared any confusion or anything like that, and we were able to just move forward and create something new. So that, I think, was the thing that bit into me, and
Mhm.
that made me want to do this more in my life. And the TED moment was to have the opportunity to talk about that. And as a result, I decided to invest even more into that. That's when I did the Second City training. And so I think it's this virtuous loop. If you do a TED talk, it's really about, the whole talk is in service of an idea. And
Mhm.
that idea isn't you. It's really all about exalting an idea that you value, that you want to share, and that's their massively transformative purpose. And the TEDx organization, the TED organization, is ideas worth spreading. So my idea was yes and, which is the first rule of improv. Yes and will change your life. And for me, it did, because it allowed me to yes and this company concept. It
Mhm.
enables me to accept who I am and who I'm becoming, or any opportunity or conflict or creative ideation or collaboration project. To yes and means to be open to that which is potentially unknown and open for the co-creation that can come with a group that collaborates together. So these two talks are really about that. I think you put them in the show notes as well. One's short,
Yes.
one's a little bit longer. But that's what it's all about. And so yes, and will change your life. In a moment of crisis, like in the moment of COVID, when we were looking for ways to have shared experiences, and how might you apply the thinking of improv into crisis management or leadership, for example. And then how might, just simply inserting yes and, or substituting yes and for yes, yes but for yes and, how might that change the way that you interact in your work life, in your family life, in your community, in how you can, let's say, manifest or create your future, be the author of your future. It really made a huge change. So for me, life-changing to do those talks, life-changing to put those ideas out there. I think it really emboldened me to give me the tools to create what I've been able to create from an entrepreneur perspective, as an artist in the community here, because now I'm running this comedy school and we're performing and we're even doing corporate events, which is wonderful because we continue to pass on these great learnings for people that wish to put that essential glue from the theater into their teams so that they can grow and create something new for their businesses.
I love that, because this is one of the things that I believe in so much. Changing perspective, the yes and instead of the yes but, totally changes your perspective of the situation. And I believe that when you change your perspective, just your point of view, just formulate the sentence um, um, in another way, totally changes the situation, totally changes the problem, transforms it into an opportunity, transforms it into, okay, maybe that's good, actually. Maybe something else is better for me if this does not work. This is the yes and perspective. So take it always as a positive thing and try to look in different ways. How do I make this work for me? How do I make something else maybe work better if the situation is not presenting itself as the most optimized scenario that I've thought about? And I think lots of what entrepreneurship is about is improv. So the fact that you're combining both, I'm sure it helps you a lot on a daily basis with dealing with different situations, because not everything works as we planned, right?
100%, Nina. So I love that you said entrepreneurship is like improv,
Yeah.
because ultimately, to be on the stage, to create a show, is to create something from nothing.
Yes.
That is what entrepreneurship is. That is
Mhm.
what leadership is. You literally have to create something from nothing. And even the best laid strategic plan, the best laid, operational plan, you will have cracks in the system. You will have mistakes, failures that you have to recover from. And so these tools of improv actually help you recover quickly. So the rules of improv are, say yes and listen. Okay, serve, like as a servant leader, serve the others and fail with joy. So when you think about in entrepreneurship or in leadership or in business, you're going to have so many failures. You're going to have so many more failures than you ever have of
Mhm.
of victories. And we know that pain and failure is the most expedient teacher and lesson giver. And so I think what helps you in the practice of improv, even if you never intend to use it for the stage, but you practice it and you try it on as a leader, it
Mhm.
helps you get more comfortable with what happens, as you say, when things fall apart. Maybe
Yeah.
your presentation to your venture capitalist fails miserably, or you're presenting to your CEO or the board and they rip it apart. How do you recover in that moment? How do you use it to reset, recover? Or, the classic thing of you've got the 2020 slide deck and they look at slide
Mhm.
number 2 and they rip it apart and you have to redo your presentation in the moment. As long as you know the general direction you're going, the skills of improv can help you reconfigure quicker. So it gives you essentially more shots on goal because you get used to how you recover from failure and how you pivot. So your brain thanks you because you really truly become an agile thinker and an agile leader in the moment with your team.
I love that. I'm very passionate about brain fitness and brain health. And the fact that you said your brain thanks you, that's very important, because I think an entrepreneur should be very brain fit, because their brain are always rewiring. We don't really have one pattern, one way of thinking. Otherwise, nobody would have succeeded doing anything, because nothing works as planned. 99% of the time, it's a different thing. It's a different case study, it's a different market, it's a different kind of client. like really you're facing a different scenario every day. So keeping your mind sharp, it's very important to
And I think on your point of like brain fitness and the role of improv for that, coming back to my company, VivaValet, we do teach improv techniques to our service providers.
okay.
So it doesn't mean that they're performing and making it funny, but some of the tools that get you to the point where you can create the listening games, the
Mm,
collaboration games, the resetting games, we teach that to them and we ask them to use those in their service. And the feedback speaks for itself because our customers are like, wow, I really feel heard. I
yeah.
feel like I've not only did they come and modify my house or put in a guardrail or grab bars or things, they actually were, they listened to me. So that's part of the tools that we're teaching. And also, we have taught improv to the elders themselves. And I'm not kidding you, Nina. It is like watching these people reverse age 10, 20 years
Oh
before
my God.
our eyes. Their posture changed. Like people who were really unsteady with a cane or a walker, they all of a sudden wanted to stand on their own. We were there watching, making sure they didn't fall, but they wanted to stand on their own. They felt stronger. You could see their posture, their voices, the way that they would look at each other was really intentional, like the way they would focus on each other. And what the people in the care home explained to me that they'd never seen that level of interaction between the residents before
Wow.
because they were like laughing and talking to each other, high-fiving each other. And you walk into that place and many of them are sitting in a chair, staring off into the distance.
Mm,
And you can see that they're there with their thoughts. Maybe they're ruminating over their memories or replaying their life, but they're
mm,
not interacting with each other. And
yeah.
we got them to play together, and it was so moving. So if we can keep using that energy in all these spaces, again, with elders in our business, in our communities, supporting the aging process, and of course in leadership, think of how better our world can be with this mindset shift.
I love it. I love it. Mindset is everything. I think someone
Yeah.
said 95% of your success is about mindset and 5% is about strategy. You can have the best idea in the world if you're not addressing it with the best mindset. And they think the improv mindset is very important because you have to stay sharp and keep learning and keep adjusting and stay flexible in this very demanding market. I know we have more than ever the tools to succeed, but the market and the clients and this environment is more and more challenging. So, talking about challenges, I love talking about challenges in the Success Catalyst because I think challenges are a stepping stone for success. So, can you talk to us about some of the biggest challenges maybe that you've observed in the elder care industry, and how is Viva Valet working to address them?
Yeah. So I would say it's societal before even the industry, it's societal because we often make these people that make themselves or society moves on, makes them invisible.
Okay.
Um, in fact, so invisible, yes, and the act of retirement has
Mhm.
been studied as one of the most unhealthy decisions we ever take in our life.
Wow.
So why? Because we lose a sense of purpose, because
Mhm.
purpose fuels our mindset, it fuels our sense of belonging. It also separates us from social networks that we had that were very clearly defined, and sense of status is in question. And often that means that you might have 6 months of woohoo, we're having fun, let's do some fun things. And then reality sets in of what's my purpose? Because I'll live for another 20, 30 years, possibly.
Mhm.
So I think that's one of the big challenges is rewiring this of of making the possibility of elders to become visible, to make them relevant and visible, if that be through employment or entrepreneurialism or utilizing the great life experiences they've had, re-injecting them back in their communities. I know that my former father-in-law is one of these people who's 80, who is like standing out in his country as someone who is an 80-year-old who's actually actively working. So how do we find a way to celebrate that more? And that means that therefore we redefine elder care as, instead of very often the visuals around elder care of being that of I'm helping you as a business or as an industry because you as an older person are helpless. So you see the visuals of these wrinkled hands, right? Like
Mhm.
one on top of the other, or the person sitting in the wheelchair looking off blankly. And actually, our experience is if you treat them with respect and if you see them where they are and honor them for the life they've lived, they actually reemerge as that person that they've always been. So, how do we change our mindset in the industry
Mhm.
to have an ableist mindset instead of having, oh, you're disabled or you're invisible? One of the great opportunities and privileges really that my founder and I were able to have is we were placed on the UN Secretary General's Council on Aging for
Mhm.
age tech white papers to say, if you're going to be creating tech, for example, for olders, what are the principles that you need to have? So if it's around fostering access, broadband access, how do we make sure that we don't leave them behind as we're creating large oceans of access, let's say from a
Mhm.
Wi-Fi perspective, but also from a design perspective, how do we put our olders in the driver's seat around design? Because often there's a disconnect, especially in tech, between the people who design the tech, or maybe they say, oh, this is what we need, we're going to do this, and we put it, we create it, we put it in the market, instead of saying, let's design this together, let's get the full user experience understood and actually put them in that process. Because I think that's very often what happens in this industry is things are done for them instead of with them. And
Mhm.
that's, I think, a major shift that we've made in our company is we've brought them along in the research that we've done, in the development of the tech and development of the services, is always have them with us in defining what does it mean to be safe? Or
Mhm.
adult children, for example, what does it mean to be safe? What does it mean to be trusted? What are the services that you need to enable you to live at home independently? Not to be served as a helpless person, but to enable you to live at home independently. So I think that's a huge thing that the industry needs is ask them, involve them.
Yeah. Again, another shift of perspective. I love that. So, I'm sure you have big goals for VivaValet. So, what's next for VivaValet? Are there any new features, services, expansions that you're planning that you can share with us today?
Absolutely. So first of all, geographically, where are we? We're in the Chicago area in the state of Illinois in the United States. So we are in a couple of counties. We're in Lake, DuPage, Cook, and Kane, not C-A-N, but C-A-N-E
Mhm.
counties. We're expanding to the rest of the state. So that's stage one. And one might ask, why there? And why not a place where you have these huge populations of olders who have moved from their home to a place like Florida, New
Mhm.
Mexico, Arizona, warm places, basically.
Yeah.
So naturally, those are our next, naturally, we're going to expand our markets, of course. But we wanted to prove before we were in an environment that's entirely designed for olders, we wanted to prove that this principle works. And we actually mined the census data in the United States, and we found this was the highest population, highest concentration of olders who are living independently in a home that they've lived in for 20 to 30 years. Because the principle was allow them to live in the same house that they want to stay in, allow them to stay there, and enable and empower them to stay there with the services that they need. So we're proving that this principle is working,
Mhm.
both from the independent living, also some independent living, inpatient independent living, or
Mhm.
in-home services. We support some of those businesses as well. So clearly, the ambition is to get outside of that initial pilot market and grow to U.S. wide. Of course, we have ambitions to go outside of the U.S. In terms of services, we've just recently launched the new service of in-home tech. So that's
Okay.
exciting because we, during the duration of the development of our company, we offered a lot of in-community tech services and like cell phone workshops and tech workshops to teach olders how to use certain features on their phones or how to set up things on their laptops, which has been really, really fun and exciting because they're so eager to learn. So it's things like that. We have a mobile app that will be launching very, very soon. We're very excited. So that
Amazing.
will
Oh,
be available. And we have some other features that are, let's say, stay tuned, that are going to be really supporting olders to capture how they're feeling and to be able to communicate that clearly so that we can also measure the baseline of how they're feeling now and how they're changing as a result of maybe working with us or as they progress. And how, as a result, does the healthcare system, the community, the family support them as we can monitor that wellness overview. So I think that's the most I can say about it now, but there's really exciting stuff. I can also say that the caregiving community is really important to all of this, and that is really the base of the community that supports this business. And again, it is generally women in my age group who are saddled with this type of opportunity, challenge, burden often. So if you look at our social, it's on Instagram, for example, VivaValet official. We have a lot of these resources that are available for caregivers in the form of, we do Take Action Tuesday, we do care updates. My founder, Marian Perina, also cares for an older on a daily basis. And so she's offering constant updates of what is she encountering? What is the learning she has? What's advice that she has? We always have these kinds of things. We have more education that's coming our way to support those people who are there. Because part of the thing, Nina, is what we realize is if you have medical care, if you hire in someone who's part of a medical service, they've been trained, they've been certified, they're licensed in that area.
Yes.
But as an adult child caregiver, you're not given that education, and
Not
very often
necessarily.
you're
Yeah.
thrown into that environment. And so maybe your parent or your older that you love, your great aunt or your auntie, they've had a surgery, an emergency, a crisis, they're in the hospital. And then you have that very important moment of discharge where they're leaving the hospital and they say, oh, they shouldn't lift any more than a kilo for a week or 2 weeks, so they can't drive. And these people are all of a sudden thrust into this moment. We're really excited because we can offer these kinds of crisis management. Like, what do you do in the next 24 hours? What do you do in the next 48 hours? What do you need to do in the next week? How do you plan that out with your family and utilize services like us to support you and augment that support as a whole family ecosystem?
I love it. And I love the fact that you're always looking to make it a complete package of services, because we don't just need that tech service. We don't just need that sudden healthcare service or specialist to come and help us. We need a whole package of well-being, wholeness, companionship, maybe tech services, compassion. I love that that feature that you're working on about getting the overall feeling or well-being status and acting from there, because it's not obvious for someone in that age to even be conscious about the way they feel, and even so after that expressing it or expressing the need that they need help maybe, or they need companionship or whatever it is that may spark that
Yeah.
need. So kudos to you for all that you're doing. I'm really excited to know more about VivaValet, and I'll make sure to add all your social links, your website, your social media handles, and your TED Talk links in the description of the episode, so that our listeners can find you easily, interact with you, and know more about VivaValet. And finally, what message would you like to leave with our listeners today, especially those involved in caring for older adults or looking for ways to support their loved ones' independence?
Yeah, so many things to say. I think the critical thing is if you are caring for an older or caring for a loved one, um, very often these are very hard diagnoses and hard moments of crisis or challenging things to learn. There's like a grieving process associated with knowing that maybe your parent who's maybe been diagnosed with dementia will never be that person that you've known before. So for that, if that's the case, first of all, I'm so sorry because I've been through that myself, and it's really tragic to watch that decline in someone that you deeply, deeply love and admire. But I think, in the moments of crisis like this, I think that to think of this as a partnership with your loved one to say, what does it mean for me to support you? What is the thing that you need the most? Because it's so easy to step in and take away the sense of independence, the sense of self-determination from an older, to say like, okay, here's the reality. here's the diagnosis, or here's the crisis, or here's the thing that has to happen. How would you like me to support you? And let them lead you in that
Mhm.
in that way, instead of just jumping in and saying, I'm doing all this. So
Yeah.
it has to be a co-creation. That's also where the yes and comes in, because once you know what it is that they want, then you can yes and it and co-create a solution that they can feel good about and not feel shameful about, or feel like they have lost their sense of agency. And
Mm.
you, as that caregiver, can feel that you're supporting your loved one and doing the right thing by them, what they need. So again, good luck to all of you who are doing that. If you're an entrepreneur and you are looking to get into the space, 65 and above is the hot space for entrepreneurship.
I
So you
love
talk
that.
really like businesses, like never in our human history, never have we seen so many businesses opening for entrepreneurs who are 65 and above. So if you're in that age group, go for it. If you want to serve that age group, also go for it. In the US alone, population of 50 million, every day, 6,000 people turn 65. That population is getting bigger and bigger every single day, and there is a huge opportunity to serve that group. We often talk about serving the youngers, and that's the advertising segment.
Yes.
Actually, this older group has resources, they're around, they have needs, and those needs are not being met, especially in the caregiving space. The problem, the challenge is so large, we need more players to actually help solve the problem and serve these people.
I love that. Thank you so much, Jennifer. That's such good advice for all entrepreneurs who are listening to us. It's been a huge pleasure. I really enjoyed having you on the podcast, The Success Catalyst, today. I learned so much about what you do, about your services, about this particular niche that now we discovered is booming, and there's a lot of need for players, as you said. So thanks again, Jennifer, for being an awesome guest on The Success Catalyst. And to all our listeners, we'll see you again in the next episode.
Thank you, Nina.